From Harry Windsor to Baptist DeLacy, from eureka moments in a petri dish to needle exchange programs on our streets, St Vincent's has long broken the mould to solve some of our most vexing health challenges through a culture of trailblazing innovation.
So Club Connect is a multifaceted cognitive training program for older adults who are at risk of dementia. People come in, it's at 2 hours a week. They have 50 minutes of psychoeducation and then 50 minutes of computerised cognitive training. It's been an idea acknowledged for a while that mental activity possibly reduces the risk of dementia. But no one has actually translated the research into a clinical population. So that's what we're doing here at St Vincent's. We're pretty excited here that the way that we deliver the project is pretty transferable, and certainly by downloading the programs onto an iPad you can take it to other settings, residential aged care facilities, other psychogeriatrics and geriatric settings.
What we've found is that surgery is a time when patients are often introduced to opioids, and some of them really struggle to come off. So one of the things that I'm focused on is making sure that our patients and our junior doctors understand prescribing and understand the long-term consequences of prescribing on discharge from the hospital. And so we came up with what's called an appropriateness measure. And so that measure looks at what the patients have used within the last 48 hours and uses that information from the electronic prescribing record to say whether discharge opioids are appropriate or not. So almost within a month, once we'd hit on this recipe, we saw a drop of about 50%. And in the 2 years that we've been doing it, we've had further improvements, and now we're up to about a 60% drop in the inappropriate discharge of opioids.
Pain management is a really big deal. 22% of Australians suffer pain on every day of the last 3 weeks when asked. The Reboot online program is a very simple online program of 16 hours over 16 weeks that uses animation, exercise videos, Tai Chi videos and information videos to help people take a journey through understanding pain, learning how to manage it, getting some feedback on how they're going, and ultimately integrating with their families so that everyone knows how they're managing well.
As we know, St Vincent's in the early 80s was at the forefront of the management of people with HIV. We were the first place to identify primary HIV infection with Professor Cooper. And the work we're doing now is the natural extension of that into the early 21st century, when such individuals are now surviving thanks to effective drugs, but are now developing a number of HIV-associated cancers, of which anal cancer is the preeminent one. What we've been able to do for the first time is to identify individuals with a pre-cancer phase and intervene and prevent them from developing those sort of advanced cancers. We've been instrumental in setting international standards in the diagnostic techniques of this particular condition. Last year we were at the forefront of leading those international collaborative efforts to establish benchmarks for the diagnosis of these conditions.